Hey folks, this is Maria Abreu from Abreu and Associates. Welcome back to my channel. Always happy to have you. Um, a question that quite a few foreigners are asking, not just on the channel, but people calling the firm and via email, it's become a popular question. What are the health insurance options in the DR? That question is really involved and it has a lot of answers. And I'm going to just say this. Health insurance in the DR is a lot like health insurance in other countries. It all depends what you are looking for, okay? Like different HMOs, different health plans offer different options. You would have to sit down and you would have to go through the packages that they have and choose the best one for you, okay? I'll give you an example. ARS Humano. Humano is a health insurance carrier here. It's an HMO. A lot of my clients prefer it. I myself, use it as part of my corporate health coverage for my employees. It's pretty good, okay? And it offers um, different packages. You would have to see, some include dental, others include maternity. You have the international packages. And most of the insurance carriers, health insurance carriers, offer these packages, the international packages. Now, this is interesting because my clients, they don't want to continue paying health insurance, like, for example, to name a country, the US, because it's very expensive. Whereas here, they can, for like 1/3 of the cost, they could have good insurance that gives them international coverage and use that insurance when they travel abroad. Okay? So instead of keeping the insurance, plan that they have back home, they just get the international plan here and it covers them when they travel. And it's, 1/3 of the cost of what they're paying back home. So when it comes to insurance, you have to pretty much sit down with an agent and ask. Kind of like tell them what you're looking for, and they'll tell you the plan that best suits you. Okay? And the cost of the plan will depend upon the plan that you get. An international plan is more expensive than, I would say, your average. Okay? But just to give you a general idea, a family of 5 would pay monthly. Let me just do this math over here. They would pay monthly, a family of 5, for coverage that would cover 100% hospital visits and 80% coverage on doctor visits and meds. A family of 5 would pay $230 a month. Okay? So that's pretty inexpensive. Okay? Um, compared to what people pay in other countries. All right. So, oh, and one thing I wanted to mention, because this is also it's not a question I just received now, but I've been asked many times. People of a certain age, meaning over 65, will they be will they qualify to get insurance coverage or medical insurance coverage in the DR? And the answer is yes. However, for people 65 and older, they are required to undergo a medical exam. The HMOs will have them go to one of their uh, certified clinics and do a medical exam. And then after the medical exam is done, then, the coverage will become active. And the reason for that is that, as you know, insurance carriers do not want to take on pre-existing conditions. This happens in every country. It's the same thing, guys. So they don't want to take on pre-existing conditions. So they want to see if there are any pre-existing conditions so that they can preclude that from the medical coverage that they will offer that person over 65. So yeah, it's you can pretty much get whatever you want. The great thing about medical coverage here is how cost effective it is. It is much cheaper than other countries, and the coverage is generally very, very good. I mean, I've had surgery in the best places in the country with the medical coverage that we have, and it's very inexpensive. So if you have any further questions, we can provide, a list of medical insurance carriers. We mentioned one because it's the one that we use and is very popular among foreigners, but there are others that are just as good, okay? And we'd be happy to provide a listing. Just contact us if you want to know. See you next time.